The following information and video are for women who have been advised by their midwife or doctor to give themselves injections to help stop blood clots developing during your pregnancy or just after you've had your baby. When you become pregnant, your blood becomes more sticky, and this means your blood can clot more easily. You may also be at risk of a blood clot if you have other risk factors. If you're a smoker, overweight, or if there's a family history of blood clots. The injection you've been asked to take is to thin your blood to reduce your risk of a blood clot developing. There are two main areas on your body where you can give the injection. The first is into your tummy around your belly button, and yes, it is safe to give when you are pregnant. Think of it as a semicircle below your belly button, and ideally keep about 5 centimeters away from your belly button when you do give the injection. Do use a different area to inject into each day to avoid any bruising, and do not give the injection into your belly button, scars or wound. The other area you can inject into is on the outside of your upper thigh, and again you can use a different area to inject into each day to avoid any bruising, and do not inject into any scars or wounds. Make sure you have the following ready before you give your injection. Firstly, wash your hands with soap and water. Make sure the area you're going to use is clean. Have your yellow sharps box close to you. And when you are going to give the injection, make sure you are comfortable. You could either be laying down or sitting. Remove the injection from its container and make sure the medicine inside the injection is clear and has nothing floating in it. Next, bend the orange safety device down and then remove the protective lid. Once you've done this, we're now going to do what's called pinch and inch. Using one hand, pinch a fold of skin on the area you're going to use between your thumb and fingers. This is because we want you to inject into your fatty tissue and not your muscle. Then, with your other hand, hold the syringe and insert it into the fold of skin. Now press down the plunger slowly until all the medicine has been given. Remove the needle and let go of the skin fold at the same time once you have given all the medicine inside of the injection. Then put it straight into the yellow sharps box. Always keep the yellow sharps box away from children. If you need a new yellow sharps box, contact your local pharmacy or your midwife. And remember, where possible, try to give yourself the injection at the same time every day. Commonly asked questions. What can you do to reduce the risk of getting a blood clot? Keep yourself hydrated and drink lots of water. Keep yourself active. Avoid sitting down for long periods of time, and avoid crossing your legs and ankles when you are sitting down or laying down. Can I breastfeed while taking the injection? Yes, you can. I take other medicines. Is this okay? It is important you tell your midwife, doctor or pharmacist of the other medicines you are taking. What should I do if I forget to give an injection? Give yourself the injection as soon as possible. Then you must wait 24 hours before giving the next injection. And remember, this will now be the new time to give your injections. What should you do if you think you're going into labour? Do not give yourself the injection if you are having painful, regular contractions, and do not give the injection if you think your waters have broken. Contact your local maternity unit for advice and support.